Welcome to the show, everyone. We're going to have a great show today. I'm really excited about bringing on my first guest. He's never been on my show before. We're live on Facebook, so hi to everybody out there. Like us and follow us. We're going to share the show later on. My first guest is Dr. Yosef, and he is the owner of Optimal Health Wellness Clinic. Welcome to the show. Doc, you got to tell everybody a little bit about your background, what makes you unique, and what we're going to talk about today.
Well, pleasure to be here, Carol. Thank you. I had a very unique background before I got into the medical field, and I began by I started as an engineer. I grew up in a home of a nuclear physicist, and for me, that was my role model, and learning about science, and I was just really enamored by the approach, how humble it was my uncle who raised me, and how humble he was, but yet so knowledgeable. And so that kind of started me off on a journey of learning more about science and my approach to what I wanted to do in my career. In my mid 20s, actually early 20s, I got sick. And I was a very healthy young man, but I used to play sports, played soccer, was doing great, and then got sick with sinusitis, so having chronic sinus infections.
Oh, that's terrible.
Yes. So, and I went to multiple doctors. I went to the U.S. I was living in Chicago, also lived abroad, and also went there, and I was prescribed multiple antibiotics and just struggled with that for a long time. And it led me to realize that there were no answers in that department, and I was pretty debilitated for about a year, and it affected my functionality. So I went from a pretty healthy person to a not so healthy person. Then upon my own research and with my wife, I had gotten married, we researched nutrition and made some dietary changes, some cleansing approaches, and it really was a remarkable way of changing my health. And so that led me to an interest. I was actually looking to pursue graduate school in engineering and biomedical engineering. My undergrad was electrical. I did some biomedical engineering minor, and my wife's like, you should be a doctor. And I said, no, it's like you have good social skills, you have the science. And so it brought me to that. But I wanted to do it differently, using more nutrition-based supplementation and more integrative approach. I think a more problem-solving approach to medicine.
Well, you are a holistic or naturopathic doctor.
Yes.
Right?
Correct.
And being that you've walked in some of these people's shoes, you've treated yourself, right? So you know
Correct.
how to treat others, right? Now, how does the type of testing that you do differ from the testing done in other doctors' offices?
That's a great question. So for me, one of the things, this is very interesting. So I don't know if you've ever heard of this person, but Dr. Abram Burr was the first homeopathic MD here in the Valley. And he really actually started the whole movement of so-called alternative medicine here in Phoenix. He started doing electrodermal testing according to Voll back around the late 70s. And that was based actually, so Dr. Voll was actually a physician but also an engineer. And he integrated concepts from Chinese medicine and acupuncture, utilizing also electronic testing devices. And he was beautifully integrated, and he was seeing some amazing results with the testing. So that was past that he taught other doctors, and eventually Dr. Burr learned from someone, and then I was fortunate enough to learn from him.
So this is called, say it again, electrodermal testing.
Correct. Electro meaning electronic, dermal meaning skin.
Okay.
So you measure different points in the skin.
With what?
With an electronic device that measures the voltage running through these points. And you're looking for the flow of energy. If the voltage drops, for example, if somebody has a sensitivity to dairy, let's say, and we're testing a sample that has a certain dilution of dairy, it will affect the energy flow along certain meridians.
Now I have to ask you a question that's not on here that I want to ask.
Yeah,
okay?
of course.
So, what kind of treatments do you do? What do you have people come in for? Anything, or do you deal with people who are allergic with stuff mostly? Tell me about that.
It's a great question. Let me first say that we use, one of the things why I call my practice integrative, I don't just utilize electrodermal testing. We use blood work, we use specialized testing, urine testing, saliva testing, all kinds of specialized tests that according to the patient, would be suitable for the diagnostic process. So then, patients that present to my clinic vary, but they're typically very chronically ill patients, unfortunately, that have been through multiple, whether it be, specialists or, other integrative doctors or holistic or naturopathic doctors, and they're not getting the answers they need. And what I find that tends to be a challenge for a lot of these people is that they're getting all this testing done, extensive thousands of dollars of testing, and in the end of it, number one, they don't really have a good, solid strategy to rebuilding their health, and then they're just, pretty much almost broke because they have no money now to the treatments, right? So I try to minimize the amount of testing that I do and really focus on the foundational components and build from that.
Well, you are located in Scottsdale on the southeast corner of Bell Road and the 101. He is highly rated on Google. The other thing that he's doing for everybody, that if the first time patients that come in and tell him that they heard it on Networking Arizona, you're going to get 15% off the visit. That number to call is 480-941-2141. You can check him out on his website. It's Dr. and then Yosef, YOSEF as in Frank.com. And very important, first of all, and I know these go by so fast, but honestly, there's so many people out there that are suffering, and they've been suffering for a long time. They can't find the answers. You need to find out from someone who, let's say, is a holistic specialist. I think that's what I would say more than anything that you are.
That's right, yeah, and I like the term integrative because I think what's unique about my background, like I mentioned earlier, is that I like to take data points. And oftentimes I think that because there's benefits to having a compartmentalized or specialized type of healthcare establishment, but if it's too over specialized, then there's a lack of communication or a lot of integration between all the different tests run and the different diagnostics. So
if you are dealing with something that's been going on and it's chronic, give him a call and let him see how he can help you. I think that's the main thing. And there's so many people out there dealing with chronic, there's pain, there's sinus problems. I mean, especially everybody was told to come here to, get away from that. And everybody that came here has it. It's crazy. But again, you could check him out on the website. It's Dr. Yosef, is YOSEF as in Frank.com. The number, write it down, it's 480-941-2141. And everyone that tells them that they heard it on Networking Arizona, those first time patients are going to get 15% off the consultation. Again, that number is 480-941-2141. It's dryosef.com. Hang tight, we're going to be back in just a minute. Okay, that goes by pretty fast.
yeah, that was fast.
I know. So we're going to keep
It flowed
on
nicely
talking
though,
here.
it was good.
Yeah, I think so too. We're going to keep on talking in here.
Yeah.
And because we're live on Facebook, that's the
Right.
reason why.
Right.
So when you talk about data points and things like that, what does that mean?
There are different tests that
Your other guest is here, he's gonna come in.
So, blood tests, for example, and a lot of the time, for example, there's a range that is considered normal. And the problem is that a lot of doctors rely on that range, anything within that range, it's considered okay. But the reality is the optimal level for each, test is really not that broad, and it's more specific. So I try to look a little closer and figure out, okay, what is, for you, these numbers don't really seem to fit, so it takes a little more work. And that's what I do, and I'm looking at different things that other doctors may not be looking at and just comparing, right?
Okay.
So that's what I mean by that.
So when we come back, I'm going to be talking about your modalities, the treatments that you
Yeah.
offer. Okay, that's where I think we should go.
Absolutely.
Because I think we've done that already.
Yeah,
Okay.
absolutely.
Yeah. When I will talk to you after you're done for just a little bit, because
Sure.
I like to go really narrow and deep, okay?
Good.
So we're gonna try and do that
I'm
here.
gonna mention actually the sublingual desensitization, which is a technique that Dr. Burr used to use, and it's for basically allergy desensitization to molds, to foods, to pollens, and
Okay.
dust.
Okay. I'm gonna let you say that word because I didn't even understand. I know, I heard the sublingual, but the other word I didn't.
Desensitization.
Oh, desensitization, okay,
Sorry,
got
my
that.
accent perhaps. Desensitizing. It's a mouthful.
I got it.
You got it.
Desensitization. There you go.
Howard Farkash Agency, we believe that protecting what matters most should be simple and stress-free. For the future you want to enjoy, our long-term coverage solutions can help you stay comfortable and secure, no matter what life brings your way. Protect your life, protect your future. Just call Howard at 602-909-8433, 602-909-8433. You'll be glad you did.
Wow, everybody wants greater health, wealth, and
I got a lot of them, sorry.
No, it's okay, I get it.
Mm.
Yeah, it does go by so fast.
Yeah, it's
Sure.
gas.
1 to 7 days, including
No matter what you do. And
Right.
plus I have to also, introduce you in the show and all
Yeah,
of that,
no,
so
I think
it takes
it's
a
great,
break.
I get it, I think it's great.
now 602-547.
That's why people come on a lot,
Right.
because they can get more out,
More
right?
information, exactly.
Here we go. Just remember, right on top.
Yeah.
So welcome back, everyone. We got the doctor in the house. We're talking to Dr. Yosef, and he's the owner of Optimal Health Wellness Clinic. And, at the break, I love to be able to talk a little bit more to my guests that are on the show. And you were talking a little bit about, obviously, data points, but you also wanted to kind of go over how the different modalities that you use to treat your patients. Go ahead.
Yeah, so very interesting. So one of the modalities that I prefer, because it's gentle and effective, is allergy desensitization.
See, it's hard
It's a
saying.
mouthful. Desensitization. So basically what it means is using drops, when we say sublingually, under the tongue, because it now is being done with injections, but there was a time when it was a sublingual process. And that gets actually used very tiny amounts. It's called isopathic homeopathy. You're using the same substance in a very diluted way, and then you increase gradually. And what you do, you desensitize to either foods, to environmental allergens, pollen, dust, things like that, including molds as well, because a lot of the immune reaction that people get is because the body needs to be retrained to not be overreactive to these things when you're exposed to them.
So, but people come in for you, again, I want to repeat this again, for almost anything, right?
Yes.
But if
yes.
you're dealing with something chronic, he's the doctor you want to go to.
Correct. Yeah, we deal with we deal with complex situations, but also with people just want to come to improve their quality of life.
How about pain?
Absolutely.
I just wanted to know, because
Yes.
most people who have chronic issues, pain is probably on the top of the list,
Absolutely.
right?
Ab-
Now, I'm sure you use a lot of different modalities.
So I was going to
for
say,
that.
actually, I'm glad you mentioned that. So some of the things that we do IV therapy, some of those IVs, and the difference is we have a lot of IV, and in Arizona it's great. There's a lot of diversity as far as, healthcare, but we customize our IVs. A lot of people go to IV places, they're already pre-made. We actually customize the IV for the patient. You need a special license to do that. And I do prolozone injections for pain management. There's also PRP. So that we address, it's really primary care and trying to use less invasive and potentially with less side effects.
But if you're chronic, he's the one you want to see, because he specializes in people with chronic issues.
Correct.
Okay, now, he's located in Scottsdale at the southeast corner of Bell and the 101. On Google, he is highly rated. You will see him there, and you're going to like what you see. A lot of different reviews that you said that you have there. Then again, his website is Yosef is YOSEF as in Frank.com. And again, his phone number is 480-941-2141. First-time patients are going to get 15% off the consultation if you tell them that you heard it on Networking Arizona. And, folks, I know that a lot of people, they're questioning their health today. Like, why am I not getting better? Or you've been going to the doctors and you're not getting answers, and you're going to Dr. Google,
That's
and,
one of my favorite.
right? You're going crazy. A lot of people
Yeah.
feel like they're going crazy and they need answers. Give them a call. Tell them what's going on and see how we can help. That's the main
I think
thing.
that's good. And I would say also that oftentimes people want simple answers, but it's a complex, I always call it the perfect storm. And identifying all the factors that basically triggered that response in the patient that eventually led to that chronic illness.
And I think also another thing today is a lot of people you know, when we used to hear about homeopathy or however you say that,
Correct.
you know, a lot of people, oh, that's woo-woo, right? But it's not. And a lot of people today, you know, you're integrative, so you
Right.
do a little bit of both, and that, you gotta do that, right?
Absolutely, pharmaceuticals are
Should have
needed.
happened a long time ago.
Right, pharmaceuticals are needed sometimes, and by the way, homeopathy is becoming so much more accepted that even
Exactly.
in some hospital websites and some medical school websites, they do mention homeopathy and application of homeopathy.
So with some of the cases that you've had, typically how long does it take for them to recover?
Well, it varies, you know, I see some very sick people, but what I try to do, I think it's important for my patients to see some glimmer of hope. So we, you know, within 3 to 6 months, we start seeing changes. I mean, the full journey could be years, right? But it's something, for me, it's improving people's quality of life, and we really emphasize that and kind of building that foundational component for energy, well-being, hormones. That's really critical. Thyroid issues, adrenal issues, so because that's foundational, and they feel the most difference when you address those.
Now, well, let's say someone's coming in and they have chronic, like you said, you had sinus issues, right?
Correct.
Was it something that turned out to be something you were allergic to?
Correct. Yeah, that was a big. So it was, for me, it was candida overgrowth, which I was never tested for. It was also having dairy sensitivity, like highly more of an allergy actually, and other foods also that were inflammatory and causing high histamine.
Foods are a big problem.
They really are.
Yeah, and also I think what's hard here is too the air quality and all of the different plants that we have. So many people are allergic to almost everything here.
It's true. We've imported a lot of plants that were not native to here, and that created obviously more problems.
So how do you treat, like with that, when somebody is dealing with a chronic, let's say, sinus issue? I know you're gonna test them and you're gonna do the electrodermal testing,
Beautifully said.
right?
Yes.
You're gonna do that first, find out, you know, and then do you also do the specialized testing with that as well?
I do, it just depends, you know, but I always run blood work with my patients, you know, depending on their budget, you know, how much we work on that, that's important too.
Do
And-
do you tell them about, you know, what to eat and, you know, kind of like you have to go and is it like, okay, like, kind of like where you have to just like, let's eliminate this now, we'll see what happens?
Exactly, we identify the potential allergens or sensitivities, and then we eliminate those. We rotate their diet also. When you reintroduce it gradually, then you can really become more tolerant while we desensitize with the homeopathy.
You know, again, a lot of people, they deal with, and this time of the year, welcome to spring.
Yes.
Right, and most people are sneezing and coughing, and there's a real reason for that. It's really not a cold, it's probably your sinuses. And a lot of people, they right away, they go and they call, and a lot of people go to telemedicine now. They can call and get something prescribed over the phone, and usually it's antibiotics. What are your
Right.
thoughts on that?
Look, when you need an antibiotic, I'm not hesitant to prescribe it, but I think oftentimes you can do other things. I mean, we even have, you know, IVs that can help with, you know, reducing the histamine levels. So there are a lot of approaches, you know, nasal rinses with specific types of nasal rinses that you can use, and there are so many things you can do before you get to antibiotics. Sometimes it's too late and you need it, but then also after that, what do you do after? Probiotic, rebuilding, and reassessing so it doesn't happen again.
And again, what would you say are the most common problems that people come in for? What are they?
So I mean, you know, they come in a lot of fatigue, a lot of adrenal issues that they don't realize they have, but chronic infections as well, sometimes Lyme-related infections with chronic Epstein-Barr, cytomegalovirus. Those viruses tend to you know, they're there for a lifetime. They don't really leave the body, but they're cyclical.
Yeah, maybe you or someone that you know knows somebody like this where they're constantly sick.
Correct.
They never seem to get better, or very frequently, and I know someone like that. So, and what I love about this show is about the information that they get, and maybe it's you or maybe it's someone that you know. Believe me, if they could get to somebody like Dr. Yosef, where they can find out, gosh, you know, what's been going on, and they find, let's say that it's food related.
Right.
Wow, what a difference it can make to someone's life, right?
Absolutely.
So you also do hormones and things
Yes.
like that. Go ahead, let's talk
Yeah,
about
very
that.
holistic approach, you know, I mean, and I think my number one thing is using less, you know, treatments that are potentially have less side effects. That's really important to me. So even with hormone balancing, I'm not as aggressive as a lot of doctors who do hormone replacement therapy. because hormones, even though, hormones have been touted to cause cancer, but it's not necessarily they cause that, but they are part of the recipe. So you have to be careful with any treatment not to overdose the patient, to be more conservative. I think that's what I try to do, and so it has to be effective and safe, and you have to be compliant. So meeting the patient or where they're at, because everybody has different challenges. So making sure they can follow the protocol and designing that and customizing it to their needs.
Do you ever find that it's not just women? Because when we talk about, hormones and things like that, most people just think that's for women. That's not true.
Nowadays, actually, unfortunately, a lot of men, and even so, I would say younger people, which, 30 years ago, 20 years ago, it wasn't the case.
Yeah, it was us old ladies.
Nowadays, a lot of young people are having
Even young
hormonal
people.
problems.
Really?
The food sources, I think a lot is food related, the chemicals in the food.
The stress.
Stress level is high.
Mhm.
We're overusing our electronic devices and staying up later, building up more cortisol levels.
Well, you know what, again, you don't know what you don't know, and I think the most important thing is to get, some answers by having a consultation. If you go in there and tell them that you heard it on Networking Arizona, you're getting 15% off. That's what he's offering for our listeners. Again, that phone number to call, it's 480-941-2141. He is right in Scottsdale on the southeast corner of Bell Road and the 101.
Southwest corner.
What'd I say? Oh, I said, what is it?
Southwest
Oh,
corner.
I wrote southeast. I've been saying that all day. Well, you know what? Just check him out on his website, which is Dr. Yosef, YOSEF as in Frank.com. And again, you can also check him out on Google. He's highly rated there. You're going to see all the testimonials there as well. You're going to love what you see. Again, check him out on his website. It's Dr. Yosef, YOSEF.com. And the phone number is 480-941-2141. What are your final words for people for today?
So what I just want to tell people, there's hope out there, and I tell people also, I don't have all the answers, certainly don't, but I can help put together the puzzle, the complex puzzle of health, and help them go in the right direction to improve their quality of life and start improving just their sense of well-being and health.
Wouldn't you like to have the quality of your life better? Right?
Right.
Wouldn't you like to be sick and tired of being sick and tired? Wouldn't you like to feel better? And so many people can relate to that today. And the only way you're going to find out is getting that consultation. And first-time patients are getting a 15% off. Or telling them that you heard it on Networking Arizona. Call them direct at 480-941-2141 on the southwest corner of Bell Road and the 101. It's drjoseph.com.